the ACA, we won big gains, right? Obviously, some of the most obvious ones were that, do you want to get it out of the, yeah. Anyhow, some of the big ones were, most of you in the room were probably affected. You were able to stay on your parents' insurance plans until 26. Pre-existing conditions, which predominantly affected women, were removed. We had the guarantee that your insurance plan could be renewed. The other huge important piece was that there used to be limits of how much, okay, so you get cancer, and then your limits of whatever, $1 million or $2 million. I mean, we all know, or you may not be aware yet, but how fast in our country medical care is, it just escalates. And there was limits. People would actually be thrown out. That was eliminated. And really importantly, and as people have said, including my friend and colleague Sandra Fluke last night, and all of us have said this, and we all know the ACA isn't perfect. Many of us here would love to see single payer. And it couldn't go that far. There was many compromises. But what we did gain was, so there's no prompter. I'm sorry, I'm going to keep looking backwards. Oh, there is a prompter. Oh, wonderful. Okay, so I think I've covered most of this, and I'm going to keep going. Some of the other really important ones under the pre-existing conditions that affected women were things related to pregnancy. I mean, if you had had a C-section that was, you were disqualified. Most of us in the room, because of the history of depression, if you had a history of back pain, if you had a breast mass, those were all pre-existing conditions. I've had thyroid cancer and depression, as are other, we are uninsured. I'd be uninsurable. The gender rating was another huge win. And as I'm talking about these wins, just realize, in case we don't get there, because that's all these other talks this morning, these aren't 10-minute talks, these are all at least an hour, it could be 2 hours, this could be a whole weekend seminar, but these are the things that we will lose, or could lose. And these are the things in the current, any of the replacement plans would be removed. Gender rating, I went over, exclusion of pregnancy coverage. I think it's important for us to remember that prior to the ACA, only 13%, is this a pointer? Can you guys, am I pointing? Got it, okay. It's okay, you guys can see it. 13% of pre-ACA plans covered pregnancy coverage. That's maternity coverage, all right? That's pretty crazy. And we knew, again, there was just many reasons why women were excluded. One of the also amazing things that occurred with ACA was that preventive services were covered for no cost. So most of you aware of that, and that was a huge change. So anything that the US Preventive Task Service Force, which is what we all go by in our evidence-based medicine world of what's good care, and people argue about that, even people in this room may argue about like how often people should have mammograms or whatever, osteoporosis screens. There are standards, and these standards all had to be included. And so what happened was that all of a sudden your colonoscopies, your mammograms, your PAP screening test, all of those were included. STD screening, these were all US Preventive Task Services AB requirements or recommendations. And so these were all automatically covered and rolled in. What was very interesting, and I'm not sure that this slide's in here, but one, and in addition to this direct access and maternity care and pre-existing, the exclusions removed, was that we saw a huge change because we didn't have a set of what were primary care preventive services for women. That didn't exist. That wasn't part of the US Preventive Task Service, and frankly, it still isn't. So the Institute of Medicine was actually tasked to come up with a list, what's included. And with that list came the things that we now get, which were intimate partner violence, screening, breast cancer, education, breast pumps being covered. And of course, the most controversial was the coverage of contraception. And that was what our speaker last night, Sandra Fluke, so eloquently kicked butt on the time, and of course that was included, and of course all of us who utilize contraception have benefited. And I actually am just going to skip forward. I might come back to this if we have time and talk about the impact on abortion, but I think I want to make sure I get through some of the impact. The insurance rate fell on all groups of women, uninsured rate. Women were most impacted. So again, you can see, maybe you can. Of course, women of color and poor women were the most impacted and benefited the most. But women and our children were gained the most under ACA. And when we looked at the share of women who did not get care, of course, that also improved. One of this was because of the expansion of Medicaid. So the expansion of Medicaid is what made all of this possible. And the eligibility coverage was huge. We know that it's working. This is some of what will happen if Planned Parenthood is not covered as a Medicaid coverage for all the other services they do, just because they and other community health centers that also provide abortions the funding is limited. So you will have access to these slides, and the remaining pile are a Kaiser Family Foundation survey that was done within the last couple weeks, talking about what the public thinks and what their impact is and what people think should cover it. And as we would expect, people know in their heart that when you talk about taking these services back away, that's wrong. So it's really up to us to, again, call your senators, call your congresspeople. We will be sending the information out from you. If you're not on the Planned Parenthood, hit list every day or NARAL, do it. They will, and moveon.org, all of those action items. And just to end, because I know people are curious quickly about abortion. So as we know, these are sort of backwards, but the ACA had to make a compromise. It was compromised in so many ways. One of the compromises that Obama made, and actually Senator Boxer, besides letting Clarence Thomas not filibustering his nomination to the Supreme Court, one of her biggest regrets apparently, and we were there actually while the Stupak language was going on, they put on a ridiculous compromise that basically codified what's the Hyde Amendment and keeping federal funding away from abortion services. So it got more complicated. It's even harder, as we know. And we know that the states can fund abortions. But now some of the other things that would be in the repeal acts are that the states may not then get any federal funding if they do this. So I'm going to stop so we can all take questions, and I apologize for the lousy slides. It was completely corrupted.